Good morning, and thank you for joining us today on the Ontario Modernization of Safe Food and Water Regulation under the Health and Promotion Act webinar. Your feedback is really important to us, and like Jennifer has indicated, if you have questions, please enter them into the chat, and we'll work on answering those as we go through the process. This is the first opportunity of three, of a minimum of 3 that you'll have to input into the changes that are going on. As we walk through this, we're going to walk through each section, and after each section, there's an opportunity to ask questions, and then there'll be an opportunity to participate in the poll, where the responses will be yes, no, or no vote, and a section for you to answer any question or any comments in. Okay, so we're going to get started, so thank you very much. And yesterday I forgot on occasion to click the slide, so my apologies. We won't try that again. So the introduction. The Ministry of Health and Long-Term Care is undertaking a comprehensive review to inform the modernization of regulations made under the Health Protection and Promotion Act that govern food and water safety in Ontario. So that's from the Ministry of Health. So the next few slides I'm going to take you through are what the Ministry of Health has defined and is working on. This review and consultation is phase 1 prior to releasing the new regulations for public consultation. So the Ministry of Health and Long-Term Care has identified their overarching goal is to modernize Ontario's safe food and water regulations by undertaking a comprehensive review focused on strengthening the overall effectiveness and efficiency of environmental health practices. So that was directly from the Ministry of Health documentation that they provided to us. They've identified some guiding principles, and they're on your screen now: flexible and responsive, evidence-based, and supporting innovation. Ensure public health benefit is the overarching consideration. Streamlined, concise, and user-friendly. Comprehensive regulations with clear expectations. And optimal use of alternative approaches. In addition, the Ministry of Health and Long-Term Care has identified some key questions that are guiding their review, and now they're on your screen as well. Are there redundant requirements that serve no additional benefit? It's one of the pieces that they want to identify and fix. Are current science and technological advancements reflected in the regulatory requirements? And if not, should they be considered? And then where are the gaps, and what regulatory provisions and policy tools are needed to address that identified gaps? And again, the next piece of this in their guiding questions is what clarification is necessary to avoid and address inconsistencies in the application across the province? Are there alternative approaches that may be better suited? And what are the expected financial or economic impacts of any proposed changes? So if there's any questions regarding those, you can type them into the chat, but that information was provided to us by the Ministry of Health and Long-Term Care. The next piece is the process that they are going through. This is not our Parks and Recreation Ontario's process. This is the Ministry's process. They've identified 3 working groups. The working groups are internal working groups to the Ministry of Health and Long-Term Care. They consist of members from public health units and the ministry team itself. These are not open to owner-operators and to stakeholders such as yourself at this point in time. In addition, there are 4 stakeholder groups that the ministry has put together: food, pool, camps, and camps in unorganized territories. And for those of you who are wondering what camps in unorganized territories are, they're logging camps, mining camps, etc. So probably not relevant to your day-to-day pool operations. The working group so Parks and Recreation Ontario has been engaged in the stakeholder working groups on your behalf, but we believe also that it's important that you are engaged directly in the process, and we're working to make sure that that happens. The Ministry of Health and Long-Term Care process is a really short, tight, timelined process. And I've got that on the screen right now. The working Group consultation and engagement is from January to June. That's the internal groups. The stakeholder group consultation, so the 4 groups that have been identified, is from January to March 1st. So that's why we're running the webinars this week, and we'll be asking for your surveys back through SurveyMonkey starting next week, because we need to have all of that feedback consolidated and back to the ministry by March 1st. They're then going to work on the inclusion of the feedback and input from March through May, and they've identified that their timeline to get information back out to the stakeholder groups is in May of 2016. Then after they've received that next round of feedback, they'll be posting the proposed regulations on the Regulatory Review Board. This is where all new regulations get posted, and it's for a period of 45 days, typically, that those get posted for input from the field or input regarding the proposed regulations. So I want to walk through where you're going to have feedback opportunities now. The SurveyMonkey that will be coming out. Again, in May, we'll attempt to, as soon as we have information back from them, we'll attempt to get that back out and look for feedback. And then again, when it's posted on the Regulatory Review Board. The targeted implementation for the regulatory changes is 2017. So again, a very tight process. Parks and Recreation is represented by the following individuals in this process, an advisory group. Dan Brizois from Ottawa, Daryl McWilliam, who's on the Parks and Recreation Ontario Board of Directors, and from the town of Oakville. Myself, Juanita Bushlip, I'm on the PRO Board of Directors and from the City of Brampton, and Diane English, PRO Director of Research and Policy and Communication. To note, the other stakeholder groups were allowed 1 player at the table. We had 3 at the meetings at the table that were invited, and we worked hard to make sure that that was the case, to ensure that owner-operator participation was in the forefront of the review. But recognizing again that that isn't enough, and again this consultation process that we're going through. Excuse me. So again, just to walk through, 3 webinars for stakeholders. That's what's happening this week. We had 1 yesterday, 1 today, and 1 on Friday. We're gathering feedback from the membership and stakeholders through an electronic survey that will follow these webinars. And then we'll create a submission for the Ministry of Health and Long-Term Care based on the survey results for consideration in the review. And we'll continue with communication with the membership and stakeholders throughout the process. Today's outcome, we're looking at pool, spas, wading pools, splash pads, and spray pads specifically. So that's the area that we're focusing on today. How this works, the Ministry of Health and Long-Term Care provided us 5 areas and questions within those 5 areas. So the first screen as we walk through this will be the Ministry of Health area focus and their question that they posed to us, or the area that they did for us. And then the second one, proposed PRO position, and then the rationale for our proposed position. After we get through those 3 slides, then we'll be bringing up the poll, asking your input, and also an opportunity to type any questions too. Okay, here we go. The first area was consolidation and minimum requirements. You're looking at the streamlining and consolidating recreational water regulations and adding merits for the currently non-regulated recreational water. So they're looking at pools, wading pools, that should say wading pools, not water pools, sprays and splads, and water slide receiving basins. And in the discussion, was looking to roll regulations to 1 regulation. PRO draft position on this is that the streamlining and completion. However, the modernization exercise must improve the clarity and consistency of regulations and standing applied in the aquatic environment, and coordination consistency beyond the Ministry of Health and Long-Term Regulation standards and acts should be done to ensure consistency of application. Water without catch basins, we will ask the question of ministry. Thank you for asking that question. Our rationale, currently, there are locations that an owner-operator must look to run an aquatic facility, and these can be inconsistent or in conflict with each other. And clarity and consistency will improve the aquatic operation. Right now, and where we'd like to focus on things like inside the building code, there's a requirement for an indoor pool lighting to be at 200 lux. However, that's only a requirement at the time of opening under the building code, and once the building inspector has left the building, then there's no other methodology to check that and ensure that that's being maintained. So we're asked the ministry, and there was some agreement. There's agreement from them that, yes, they would build in how to wrap looking at the critical items in the building code into the inspection process. But that's the type of thing that we're talking about. Also, inconsistencies around first aid kits, etc., and we'll talk about those a little bit later. Okay. I'm going to post if there's any questions, if you could type in any of your questions. And as the questions are coming in, I'd also ask Jennifer to post the poll. There's, again, 3 options on the poll: yes, no, or no vote. You just click on your option and it will automatically show on our results. We're not displaying the results as you go through, but we're tracking that information. And again, I'd invite you to type in any questions. So Chris, thank you for your question. What did the statement clarity and consistency beyond the regulations mean? So the Ministry of Health and Long-Term Care only looks at a certain portion of the regulations. We're talking about consistency and lining with building code requirements, with fire requirements, etc., where they're inconsistent. Another good example would be change room doors, and in the public pool regulations, it says that the pool area must be secured when not supervised in a Class A facility. However, in the fire regulations, you need to provide 2 egresses from a change room, and often that second egress is onto the pool deck, and people have been fined under the fire code for not having the second egress open. So there needs to be consistency on how those pieces are managed. Hope that answers the question. If it hasn't, please let me know. Okay, I'll give you a second longer. Yeah.
It's Connie.
Hi, Connie.
Hi. Would that also look at ASHRAE, those types of
We asked them to look at everything that touched the aquatic environment. Yeah.
Perfect. Thank you.
Okay. Thank you for the question, Connie. Yeah. So in the input for consideration, there was a question around phasing in and the costing. Yes, there would have to be a phase-in, and there's probably going to be grandfather components inside of it as well, but we don't know the exact answer from the ministry on that. But yes, it did come up in conversation. Okay. Thank you very much. And with your permission, I'll move on to the next one. Public disclosure. Merrick waterfront environments is not covered in this one. There's a separate piece that's covered for waterfront environments under the camp regulations, and that was a big conversation. And Diane and I are having another conversation regarding that and how to engage the membership in the camp regulation component. Okay. Issue 2 is public disclosure. Public disclosure of public health inspection results was the area of focus from the ministry. Our position is that PRO supports the public dissemination of inspection reports as long as there is consistency in the application of the standards. And our rationale is open data and public disclosure will strengthen the industry. However, there's a need to ensure that variations in interpretation of the standards will be reduced through consistent language. Okay. So this would, we don't know what this would look like yet. The ministry would be exploring a bunch of different pieces inside of here. However, you should consider such things as the green, yellow, and red disclosures for food premises. Okay, I'm going to post any questions. If you have any questions regarding this item, please type them into the chat, and I'd ask Jennifer to post the poll at this time. For those of you who are posting that you're interested in the waterfront and public beaches, the whole chat is recorded, so we will make sure that any additional information that may come out gets to you in this. And Shelley, given that health inspectors are only human, how do we propose an increase in consistency? Most of it is an increase in the consistency in the language of the regulations is what we'd be pushing for. In addition, we heard from the ministry that they're undergoing some training changes for the health and public health inspectors.
That's a great step, Juanita. Would that also take a look at if they're posting green, yellow, red? Let's say it's a Band-Aid that's missing. Does that, right. And you could actually correct that. Will it take a look at some of those things that are really not critical and then not include those? Right. Or perfect?
Yeah, so that conversation occurred as well around ensuring that there was don't close somebody for a Band-Aid. Yeah.
Okay. And then there would be a posting.
Right, and we agree that there's consistency issues with health inspectors from unit to unit and from inspector to inspector, and that was brought up in the conversations in the stakeholder group and the necessity to have clear communication, et cetera. Okay.
Perfect.
Okay, so with your permission, I'll move on to the next slide. Thank you again for those of you who are participating in the polling. We really appreciate your feedback. If you're choosing not to participate in the poll, that's fine as well. You will be provided an opportunity through the SurveyMonkey survey that's going out after. Clarification of operational processes. So the ministry identified that stakeholders have identified several gaps or requirements that may conflict with industry best practices. Again, our position is coordination and consistency beyond the Ministry of Health and Long-Term Care Regulation Standards and Acts should ensure consistency of application across Building Code, TSSA, Ministry of Labor, WSIB, etc. And then our next recommendation is that a stakeholder group of experts in the area of pool, physical plant, and chemistry should be convened to gather industry best practices for inclusion. And that there's a need to ensure flexibility in the regulations to support advancements in the field. The regulations were written longer than a lot of you have been alive and have not changed. So the technology that's in place now was not in place when the regulations were written. And when asked simple questions like the value of the makeup water volume, there's lack of clarity on where that came from or the value of that in our current environment. There's also inconsistency between the various regulations that leads to conflict and lack of clarity. Turnover rates are different inside of the building code than they are inside of the public health regulation. And regulations have failed to keep pace with industry advancements around technology and environmental considerations. I'm just reading some of the questions. How do you propose that we have flexibility and yet consistency in enforcement? I think it goes back to how is the regulation written that provides options or the minimum standard but allows for that advancement of technology. I hope that answers the question, Shelley. And unfortunately, we don't have healthy discussion around it without a clear answer yet from the ministry, but if you have recommendations, that would be valued as well. And with your permission, we will, if you have any questions regarding this area, and I'll ask Jennifer to post the poll. Thank you. I will add AODA to the as a resource. It was a conversation piece, but we'll make sure that that's tracked as well. We are continuing to, who's ensuring that these encouraged stakeholders are actually being invited to the table for discussion? We've been, I think the Ministry of Health and Long-Term Care might be sick of hearing from me through email, but we're continuing to follow up with them on our recommendations. Okay, and with your permission, I'll move on to the next slide. I know a couple of people are typing, so I'll try and follow up with those ones as well. The issue 4 that was identified is around operator training. Stakeholders have raised the issue of mandatory training in recreation water operations for public pools and spa owner-operators. While Regulation 428, which is the spa regulation, currently includes some training requirements for spa operators, there's no provincially standardized training resources for the operation of public spas and pools. Our position in this area would PRO supports the implementation of a safe pool water operational training standard, and that this needs to be responsibility driven. That not all people who are in supervisory capacity or running aquatic facilities are doing the same functions. There needs to be greater clarification or definition on the roles and responsibilities within the pool and spa operation. So when the ministry talks about an operator, that is who operates the entire facility. In most municipal operations, at least, an operator refers to those who take care of physical, plant, and chemistry. Then there's supervisors, management, owners, etc. So our request is that the ministry look at defining the roles so that there's clarity around the roles, and then look at what are the required training standards that need to be implemented based on each of those roles, so responsibility driven. Brian, from the last question you asked, who would the industry leaders be in physical plant? There were some players at the table around pool and Spa Canada, etc., that were at the table. ORFA is at the table, and those people we assume would be invited, and also looking at other industry experts, but they have not been identified yet. Laura, would this remove lifeguards from doing some operational duties? In small operations, I think that's impossible to do, but again, that clarification of roles and responsibilities under the regulation, and then what training needs to be provided at each of those levels to ensure safe operation. Our rationale is there's lack of clarity around the roles again, and there's no consistently defined standard that can be applied to support the delivery of aquatic programming and physical plant chemistry requirements. Aiding, yes, that we're really referring to training and certification. It's a combination of both. That if you can't track it, it's really hard to say that it's been done. Okay, I would invite you to type any questions at this time, and then Jennifer to post the poll. And again, I thank those who are participating in the polling. It is really helpful for us. I know that some people are typing. Jennifer, did you see Shelley's question? Shelley, if we can't do it in this section, definitely in the SurveyMonkey that's going out, those will be separated so that you can make statements on both, if that's okay. Yes, for all of the questions, we'll do that. Okay. I'm going to move on to the next slide. And thank you again for participating in the poll. The next area, there is issued, labeled as 5. 5 is broken into several categories. So we'll start with 5A, which is emergency telephones. And the Ministry of Health and Long-Term Care is looking at emergency telephones in aquatic environments. Our position is there's need for clarification and consistency between the regulations regarding the application of emergency telephones. And there's a need to include provision of cell phones and other related technology as backup within the regulations. An example of what we're talking about here is that you need, in the spa regulation, you need a phone within a certain distance of the spa. When you're working in the auditorium that has multiple components, sometimes that ends up needing to be placed in the middle of your main tank based on strict interpretation of the regulations. That doesn't make sense. So we're asking that the ministry look at this and say that there's clarity around that. And also, because the regulations were written so long ago, the lack of clarity regarding the cell phone use technology there's nothing written into there. So we're looking at using it for backups where applicable, and ensuring there's consistency across the regulation, and what to do when you hold a facility that has multiple components. And we believe that part of that will be covered off when they roll the regulation into one. If there's any questions, we can invite you to type your questions now, and for Jennifer to post the poll. Lisa asked the question, any consideration for having a phone directly connected to EMS or not? And yes, that was part of the conversation around the testing of that item as well. Obviously, that provides an opportunity to go directly to the EMS system, which is good. However, we know that in some areas the testing has been problematic, and there needs to be clarification on that. And we'll wait for people to answer this question in the poll. And we'll move on to the next one. Thank you very much again for inputting. The 5B is aligning of certifications, and it's the definition of a current first aid certificate differs between our regulation 565, which is the pool regulation, and 568, which is WSIB requirements. PRO supports consistency across the regulations, but we need to ensure that the public safety, the needs of public safety, not just worker safety, are identified and addressed. And our rationale is not all standard first aid certifications are the same based on the WSIB module delivery system. And standard first aid in aquatic environments must ensure that situations and incidents that commonly occur are addressed in the training and certification. Under the WSIB model, a module model, a certain number of modules must be selected to call yourself standard first aid, to qualify as a standard first aid. Then there's a whole bunch of modules that are optional models. Because WSIB is focused on workplace safety and not overall community safety, that means that some standard first aids do not include such items as child and infant resuscitation standards. In our aquatic environment, where we recognize that a large number of users are in that age category, there's a need to ensure that they're included. Also, so they're not all created equal. We need to ensure that the needs of our community are identified in any standard first aid certifications that are accepted under the regulation, pool regulations. I'd invite any questions at this time on this topic. And for you to join the poll. Okay. And with your permission, I'll move on to the next slide, which is first aid box requirements. I'll just wait for the poll to go down. And thank you. Thank you for your comments and input onto that last one. First aid box requirements. Prescriptive approach and no standardized list of minimum first aid box requirements across the 3 regulations. So there's great inconsistency across the regulations about what is included in a standard first aid box. The PRO draft position is that relevant first aid equipment should be identified related to the training standards for first aid and lifeguarding. Is the need for 12 safety pins required in the pool regulation? And specific quantities should be replaced with quantities with the wording such as quantities that support the specific environment and volume of participation. Again, the regulations were written a long time ago and therefore sometimes don't reflect the changes that have been made in advancements in training and certification standards. So our rationale is that they're inconsistent across the regulation and the content lists are not reflective of the needs of the aquatic environment and changes to first aid standards. And we were pretty open with them about the fact that multiple facilities have first aid kits that are taped up and only opened when the health inspector shows up. In addition, there was a positive conversation around the use of inclusion of PPE, masks, and gloves in first aid kits that currently doesn't sit inside the regulation. And I would invite you to ask any questions, type any of your questions at this time, and for Jennifer to open the poll. AED unit, Michael asked a question regarding AED units in aquatic environments in the new regulation, and yes, that was a conversation inside of the stakeholder meetings. Merrick, we didn't address oxygen, but we can bring that up as well. Okay, and we're on to the next question. Again, thank you for participating in the polling and adding your comments. It's very important. Consistency of certifications 5D. The titles of certificates listed in the regulation may have changed and/or there may only be a partial list of current providers. PRO supports, our draft position is PRO supports a single lifeguard supervision standard, and that single lifeguard supervision standard be the Lifesaving Society National Lifeguard Program. Our rationale. This issue has been addressed. The question has been asked multiple times by the Ministry of Health and Long-Term Care and addressed by stakeholders in Ontario in 1996, 2010, and 2012. Consistently, stakeholders supported a single lifeguard standard and that standard be the National Lifeguard, Lifesaving Society National Lifeguard standard. PRO supported the CPRA position regarding a single lifeguard standard for Canada and that standard be the National Lifesaving Society National Lifeguard Program in a unanimous decision. I just wanted to give a bit of background because I know that there's a lot of questions that will come up around this. The standard is not owned by the Lifesaving Society. It is fostered or supported by the Lifesaving Society on behalf of a group of organizations that came together. National Lifeguard was formed by a conglomerate or an advisory group that came together to build the standard. 50 years ago, National Lifeguard was not the standard. Each municipality owned their own standard. At the request of employers at that time, they asked that a single standard be brought together. That advisory group included CPRA, the Lifesaving Society, Red Cross, YMCA Canada, the Armed Forces, etc. That standing advisory group is still in existence, and every time a change is advised for the National Lifeguard Program, that group comes together. And that group comes together also approximately every 2 years to look at the standard and ensure the standard's in place. This standard is not, the Lifesaving Society delivers no National Lifeguard programs directly. It's open to all to deliver across Canada. The standard is maintained by the Lifesaving Society using resources from the Lifesaving Society and inclusion of all affiliates that run the program. The standard is the standard set as well as the delivery standard for content and instructor training and for tracking and quality assurance. But again, the standard is not delivered. No courses are run by the Lifesaving Society. They own the standard and they maintain the standard. So the question yesterday was around it's a monopoly. It's not a monopoly because individual providers of the National Lifeguard Program actually set the price, timing, etc. for the program. And all are welcome to, all are welcome to offer the standard. Okay. I would invite any questions to be typed in at this time and at the same time for the poll to open. Mike, yes, there was a discussion regarding the newer Red Cross lifeguarding program that came up at the stakeholder groups, and why we believe this is also why we believe it's important that we pose the question to our membership to ensure that what we've spoken about in the 3 previous times and on the CPRA standard is what our membership wants. In particular, what our owner-operators want. Shelley, the National Lifeguard is a single standard. You can, there's 2 ways to manage this question, If the ministry was willing to take over the management of the standard and the training standards and delivery standards, that would be one thing. We did not get a sense in the meeting that they were willing to do that. So, or had the resources to do that. The other piece is around when we look at the model around first aid and could that model be applied, the ministry manages that model and sets the standard. But as we spoke about in the last time, all standard first aids are not created equal, and therefore owner-operators need to make a decision regarding which standard first aid they are delivering to ensure the needs of their clientele are being met. I hope that answers the question. There will be more opportunity to participate in providing input as we move into the SurveyMonkey survey as well. Okay, and we're going to move on to the next one. Okay, the next area is around admission standards. So the ministry, the Ontario Chief Coroner has recommended that Regulation 565, our pool regulation, be amended to include pool bather admission standards. PRO supports the recommendation of the Ontario Chief Coroner regarding the application of a bather admission standard. And through the conversation, we recognize that the recommended admission standard is being implemented in the majority of locations already. And that when the ministry also did an education piece through their public health offices and going out through the public inspections and disseminating that information, there was a really positive pickup on that. And we also believe that the supervision of children is important and the responsibility of all, and that a single standard would assist in providing that. I would invite any questions at this time and for the poll to be posted. Merrick asked the question whether the responsible guardian of 12 years of age be increased to an older age. It's all open for consideration, so I'm not sure at this time, Merrick, sorry. And thank you again for the people that are participating in the poll. We appreciate your input. Mike, the implementation of the admission standard it probably won't be part of the standard. It'll be the standard and leaving it open for options on how that's implemented on the admission standard. Okay. Okay. So thank you, and we are reading the chat as it comes in and keeping track of it. And remember that the chat, all of your chat comments will be recorded and tracked, so we're not losing those if I hadn't gotten to them. So now we open it up. So those are the end of the question areas that the ministry posed to us. I recognize that they're very high level, as this is the first round of their input gathering. As we get more information, and as the regulation is shaped, there'll be other opportunities, we hope, to allow you to provide input into it. I would invite you at this time to, if there's any other questions or considerations on any other topic, to type them into the chat box.
Question, Juanita, it's Connie.
Yep.
Chemical minimums or maximums, would that come under the first area of focus under minimum requirements? Or be a part of?
That's where we actually stated, Connie, that there was a need for a fifth stakeholder group to come together to look at those specific requirements. That the table that was put together by the ministry did not allow for enough time or expertise at that table to dive into that level of review. And more time was needed.
Okay.
More time was needed on it.
Yeah.
We've asked the ministry for that to happen. The whole table, the stakeholder group asked for that to happen. We have not heard back from the ministry as to whether or not they're going to do that yet. We hope they are.
Yeah, definitely. Okay.
Mm-hmm. Thank you for the comments. Yes, Chris, has anyone considered looking into the experience in other provinces where there's more than one lifeguard program provider? Yes. The ministry has been looking at that as well, and we're monitoring that. I'm just looking. Okay. Again, we're tracking the questions that are coming in and your input that's coming in. Okay. We have a fair number of people typing, which is helpful. Thank you very much. The Drowning Prevention Research Centre of Canada was also in the stakeholder groups, providing input into drownings in supervised settings and non-supervised settings. Okay. Okay, so just to go on to the next steps, you'll be receiving a survey from us outlining the same questions will be presented in the survey as were presented today, and with an opportunity to spend more time providing comment, which would be extremely helpful. We request that one survey per organization be completed if at all possible. We recognize that at times that coordination may be challenging, but we would prefer that if possible. There is no anonymous survey participation. All users, all surveys will need to identify themselves, an email address, and the organization that they're participating in. We believe this is really important as we provide feedback to the ministry so that we can acknowledge and provide information regarding the number of people that participated, the organizations, the size of those organizations, and the populations that they serve. So anonymous feedback will not be allowed in the survey. It is a very tight timeline for you to complete the surveys. They'll be coming out after the 12th, so recognizing that Monday is Family Day, you'll have from the 16th to the 19th to complete the survey. So we need your feedback. This is the first of the opportunities to participate, but we believe this is the most important point to participate. And then once the draft regulations are released, we'll be providing another consultation period and providing you an opportunity to participate. Shelley, will people who aren't able to participate in the calls be given an additional opportunity to provide feedback? Yes, the survey will be posted and available. Are there any other questions? We've got lots of people typing. We'll just wait a few minutes while people type in their questions. Kristen, uniform identification, yeah, will show up in there. It wasn't a specific question from the ministry. Again, we'll be looking for what do they write into the regulation as it comes out into the draft regulation, and then provide the opportunity. And Diane's identified that all the survey will be circulated to all PRO members and people who have attended the PRO Aquatics Conference. And the webinar is also being recorded, so anyone who missed it can listen in. Okay, if you have specific questions, technical questions or comments, please feel free to contact me at my email address, and it's up on the screen now. It's juanita.bushlip@brampton.ca, or if you have general questions regarding the webinar or the process that we're undertaking, you can also contact Diane in English. We'll leave the screen up for a little while, recognizing that my name is not the easiest to spell. And again, we'll leave it open if you want to type some additional questions. That would be fabulous. The presentation, the whole webinar will be posted. Scott. And then that will include the slide deck. Okay, and not seeing any more questions coming up. I'd like to thank you for participating today. Your input is really, really important. If you know colleagues or people from other organizations that have not participated in a webinar, we have our last webinar on Friday, and it starts at 2 o'clock on Friday afternoon, and we would hope that you encourage them to participate in the webinar and get this information. And again, please watch for the survey as it comes out, and make sure that you're filling it out and providing your input. Again, we believe this is one of the most critical points in inputting so that we can provide meaningful feedback to the Ministry of Health and Long-Term Care. So thank you very much, and we will talk to you in May again.
Thank you very much, Juanita.
You're welcome.